Insufficient levels of physical activity are a global problem and cause several million deaths per year worldwide. However, a substantial body of literature exists on potential actions such as interventions, programs, and infrastructures to promote physical activity. The framework for tendering, developing, financing, and implementing such actions are public policies, and the importance of policy for promoting physical activity is increasingly recognized. But despite the increasing efforts of countries to promote physical activity, more guidance is needed to improve policies in this field. Currently, different tools and initiatives exist to monitor and audit policies for physical activity promotion, such as WHO's Health Enhancing Physical Activity Policy Audit Tool or the European Union's Physical Activity Country Fact Sheets. When we look at the different steps of the policy-making process, these tools focus on the question of which policies have been adopted in a particular country. However, there is also a need to assess their status of implementation and to check whether existing policies live up to international standards of best practice. This is why we developed the PA-EPI, the Physical Activity Environment Policy Index, a tool to benchmark the implementation of national public policies for physical activity promotion. The PA-EPI is built on existing frameworks such as WHO's Global Action Plan on Physical Activity and ISPA's 8 investments for physical activity. To develop the tool, we first audited national policies in 4 European countries using the HEPA-PAT to better understand the current status of physical activity policy development. Furthermore, we conducted systematic literature reviews in different policy domains and reviewed relevant policy documents from international and supranational organizations. The resulting prototype of the PA-EPI was reviewed and subsequently refined by more than 50 academic experts and 40 policymakers. The final version of the PA-EPI consists of 2 components. The policy component comprises 8 policy domains such as education, transport, and healthcare. The infrastructure support component aims to facilitate the implementation of policies in 7 domains such as leadership, governance, and workforce development. All in all, these 15 policy and infrastructure support domains include 45 good practice statements. For each of these statements, good practice examples were identified that serve as international benchmarks. Countries that aim to conduct the PA-EPI would follow an 8-step process that is led by non-government stakeholders and researchers and involves government officials to validate the evidence. A pilot test of the PA-EPI has been conducted in Ireland. Preliminary results show that 19 out of the 45 indicators of the PA-EPI received a medium implementation rating. 25 received a rating of low, and 1 received a very little or no implementation rating. Based on the pilot test of the PA-EPI, a panel of national stakeholders formulated specific recommendations to further develop the physical activity policy environment in Ireland. As a next step, further applications of the PA-EPI in other countries are needed, and the results of these tests can be used to refine the tool and the process of its application. Based on the identified examples of good practice, a global good practice database could be created, and the evidence base of the tool should be upgraded regularly through systematic literature reviews and other appropriate strategies. As the PA-EPI is not the only tool that monitors policies for physical activity promotion, efforts are needed to integrate it into existing monitoring frameworks and to ensure that the different tools complement each other. If possible, the benchmarking of policies for physical activity promotion should be expanded from the national to the regional and local level. If you're interested in learning more about the PA-EPI, please have a look at our article and check out our website for more information.